Greetings! Welcome to presentation video of small group discussion of B3. In this video, we will talk of further topics surrounding water-soluble vitamin in coronary arterial disease. But before that, here's a slide about our team member of B3. A table of content for these topics. And without further ado, let's move to our starting point at introduction.
My name is Aisyah Lathifah Taqiyyaa with your last digit number is 076. Background. Water-soluble vitamin are a group of vitamins that are soluble in water and can be easily absorbed and transported in the body. They include vitamin C and the B vitamins such as thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, biotic, folic acid, and cobalamin. Coronary artery disease is the most common heart disease caused by plaque built up in the walls of the arteries that supplies blood to the heart and other parts of the body. Water-soluble vitamin plays an important role to maintain the function of heart and vessels. For example, vitamin B6 plays a role in homocysteine metabolism. Vitamin B12 regulates homocysteine levels, and vitamin C, a powerful antioxidant that helps protect the cells and blood vessels from oxidative damage. This paper will more discuss about possible risks associated with lack of the water-soluble vitamin and roles of nutrition approach to solve the problems. Problem formulation. What is the definition of water-soluble vitamin in coronary artery disease? How is the method of journal searching? How is digestion and absorption of the water-soluble vitamin? How is recommended daily allowance of vitamins? What is the possible risk related to nutrition problem might develop? How is nutrition approach to help solving problem? Objective of study: to define what is water-soluble vitamin in coronary artery disease, to explain the method of journal searching, to understand the digestions and absorption of water-soluble vitamin, to understand the recommended daily allowance of vitamin, to understand the possible risks related to nutrition problem might develop, to understand the nutrition approach to help solving the problems. Benefit of the study. Benefit of the study is enhanced comprehension of the relation between water-soluble vitamin and coronary arterial disease and improve the understanding of the writers about the topic.
My name Pande Nyoman Dimas Pratista, three last digit of my student number 201. Now I would like to present about definition of water-soluble vitamin in coronary artery disease. Water-soluble vitamin are a group of vitamin that dissolve in water and can be easily absorbed and transported in the body. In the context of coronary heart disease, these vitamins have an important role in maintaining heart and blood vessel health. There is a relationship between water-soluble vitamin deficiency and the risk of heart disease. Several vitamins that falls into this category such as vitamin C, vitamin B6, and folic acid. Vitamin C has antioxidant properties that can help protect blood vessels from oxidative damage. Vitamin B6 also play a role in the metabolism of homocysteine, folic acid for homocysteine metabolism and DNA synthesis. Water-soluble vitamins are vital for biochemical reaction, energy for metabolism, DNA synthesis, and immune support, and overall health. They are not stored in large amounts, so regular intake through a balanced diet is crucial to prevent the deficiency. Thank you.
My name is Gusti Agung Aryawangsa with my last digit number is 144. Now I will explain about method of journal searching. In writing this paper, we use the literature review method. The keywords that we use in this research are water-soluble vitamins, coronary artery disease, and nutrition. The sources of literature used in compiling this literature review are through international journal websites such as PubMed, ScienceDirect, ResearchGate, and Google Scholar, published from 2019 to 2023. The data used in this research is secondary data obtained not from direct observation, but obtained from the results of research that has been conducted by previous researchers and then arranged in such a way according to the problems and topics discussed.
My name is Raymond Budianto with Sudastra number 161. Now explain about digestion and absorption of water-soluble vitamins. Water-soluble vitamins are a group of essential nutrients that are crucial for maintaining optimal health. They include vitamin C and vitamin B complex. Water-soluble vitamins are not efficiently stored and must be regularly obtained from the diet. The absorption of water-soluble vitamins is a complex process influenced by various factors. Compounds like peptides and tannins, which are commonly found in whole grains, legumes, and tea, can form complex with vitamins, reducing their availability for absorption. This is why soaking, fermenting, or cooking foods rich in phytates and tannins can help improve the bioavailability of water-soluble vitamins. The pH level of gastrointestinal tract also play a role in the absorption of water-soluble vitamins. For instance, vitamin B12 requires an acidic environment in the stomach for optimal absorption. Moreover, the health and integrity of the intestinal mucosa are vital for the absorption of water-soluble vitamins. The small intestine, particularly the jejunum, is responsible for absorbing most of these vitamins. Conditions that affect the integrity of intestinal mucosa, such as inflammatory bowel disease, celiac disease, or pancreatic insufficiency, can impair the absorption of water-soluble vitamins. That's all from me. Thank you.
Hello, my name is Kevin Andrian Candra with my class number 095. Today I will explain the continue of digestion and absorption of water-soluble vitamin. The gut microbiome, the vast community of microorganisms residing in the gastrointestinal tract, play a significant role in the absorption of vitamin, including water-soluble vitamin. Example, certain bacteria in the gut produce enzymes that break down folate into different forms, affecting its absorption and utilization in the body. Gut bacteria can synthesize cobalamin, although the amount produced may not be sufficient to meet the body's need. This difference in the gut microbiome may contribute to variation in the absorption and utilization of water-soluble vitamin among individuals. Water-soluble vitamin can be obtained from two sources, namely endogenous or in the body and exogenous or from food. The following are the type of water-soluble vitamin and their role in digestion. B1, be the cofactor for many enzymes in carbohydrate metabolism. B2, be the redox reaction in form of FAD and FMN. B3, trigger the synthesis of NAD and NADP, which are involved in redox reaction. B5, be the energy and hormone formation through the synthesis of coenzyme A. B6, be the role in several enzymatic reactions such as transamination, decarboxylation, and glycogen phosphorylase. B7 have role for metabolism of fatty acids, amino acids, and gluconeogenesis. B9 and B12 have role for nucleic acid metabolism and the formation of red blood cell. And the last one, vitamin C, have role for formation of collagen, bones, boost the system immune, and has antioxidant properties. That's all from me. Thank you.
Next, I'm going to talk about RDA. But first, I'm going to introduce myself. My name is Joshua. My last 2G number 205. To know how much vitamin intake a person needs, the recommended daily intake or RDA was created. The RDA is defined as the average daily level of intake sufficient to meet the minimum nutrient requirement of nearly all 97% until 98% healthy people. Water-soluble vitamins consisting of vitamin B and C, the dietary allowance for vitamin B and C must be regulated between the amount needed to prevent symptoms of disease such as due to vitamin deficiency. In example, scurvy normally is around 10 mg per day in adults, and most of the vitamin C is not stored properly in the body, but instead is excreted in the urine, approximately 200 mg per day. Therefore, the RDA is set a level that will prevent scorbutic symptoms due to inadequate vitamin C intake.
Okay, hello. My name is Niputu Dinda from Sudastra. With my student number is 130. Now I want to explain about RDA or Recommended Daily Allowance Guideline for daily water-soluble vitamins intake per day by the Indonesian Ministry of Health. So this is the bell summary of adequate amount for vitamin in a day, and it is also divided into several categories. There is infant or children from 0 months until 9 years, and then there is adults, both male and then female, and also there is pregnant mother from first, second, and third trimester, and the last one is breastfeeding woman. And for the water soluble vitamins consisting of from vitamin B1, B2, B3, B5, B6, B9 or folate, B12, and vitamin C. Okay, so from this table, we can conclude that as the age increases, the need of vitamin in a day also increases. And in the conditions of pregnant and breastfeeding women, they will need more vitamins than normal people. And also in male, they will need more vitamins compared to a female. There is also related with basal metabolic rate. Okay, so that's all from me. Thank you.
Hello everyone, my name is Fricillia Wijaya with the last digit name is 236 and I will explain 2.5 possible risks related to nutrition problem might develop. Malnutrition is an independent risk factors that adversely affect clinical outcome, quality of life, physical functions, and patient's autonomy. Early identifications of at risk of malnourished patients is critical to initiating timely and appropriate nutritional support. Poor nutrition can contribute to the development of obesity, especially when combined with a sedentary lifestyle. Consuming excessive calories, unhealthy fats, and sugary foods can lead to weight gain and obesity. These are some examples of possible risks that may develop from poor nutrition. First one is type 2 diabetes, next one is stroke, and the last one is heart disease. That's all from me, and the next one will be explained by my friend. Thank you.
Hello, my name is Komang Ayu Widhiani, and my last three digit after the number is 044. And now I will continue my friend's presentation on the same topic. Possible risks related to nutrition problem might develop. So in addition, inadequate nutritional intake can also cause micronutrient deficiencies, especially in water-soluble vitamins. Moreover, in patients with coronary artery disease, intake of water-soluble vitamins such as niacin, riboflavin, thiamine, pyridoxine, and vitamin C decreased. Deficiency of water-soluble vitamins can develop several risks of health problems, as can be seen in the table 2, problem related to water-soluble vitamin deficiency. Each deficiency of each vitamins, both B-complex vitamins and vitamin C, has different health risks, such as skin disorder, infection, nerve degeneration, neurological symptoms, metabolism, endocrine, psychological, and worsens cardiovascular health itself, as you can see in the table. That's all from me. Thank you.
Hello, my name is Kadek Pramudya Karna and my last three-digit number is 165. And now I will continue the presentation with nutrition approach to help solving the problem. A comprehensive nutrition approach that emphasizes adequate intake of water-soluble vitamins B complex and C is essential in managing coronary arterial disease or CAD. Optimal levels of these vitamins are associated with a reduced risk of CAD by regulating homocysteine levels and protecting against oxidative stress. Incorporating a diverse range of vitamin-rich foods into the diet, such as lean meats, whole grains, legumes, leafy greens, citrus fruits, berries, and bell peppers, can help ensure an adequate supply of these vitamins. It is important to monitor nutritional status and vitamin in levels regularly and collaborate with a registered dietitian to develop personalized dietary interventions. Moreover, adopting a heart-healthy lifestyle, including regular physical activity, smoking cessation, and stress management, further enhance the effectiveness of the nutrition approach in improving overall cardiovascular health. That's all for me. My friend will continue the presentation. Thank you.
My name is Gusti Ngurah Pratyaksa with the last 30 digits 112. So now I'm gonna continue about the nutrition approach to help solving the problem by giving some specific vitamins as examples that are the vitamin B1 or thiamine and vitamin C. The first one is the vitamin B1 or thiamine, which has a role in carbohydrate metabolism. So if there's deficiency of this vitamin B1, it can cause the cell damage, endothelial dysfunction, oxidative stress due to the hyperglycemia. This hyperglycemia can also increase the glycation of protein, both intra or extracellular, and leads to vascular damage such as atherosclerosis. This hyperglycemia can also activate the polyol pathway of glucose metabolism, which can disturb the glutathione regeneration by using the NADPH and causing the increase of the oxidative stress. And the next is about the vitamin C, which can regulate the active form of the glutathione as antioxidant and regulates the reduction and oxidation reaction in the body. However, there is a controversy due to the differences in results stating whether there is a relationship between this vitamin C and coronary arterial disease risks. The first one from the Ilskers study by giving different concentration of vitamin C to hypertensive rats shows that there's an improvement in endothelial function, a decrease in NADPH oxidation, and an increase in nitric oxide synthesis, which shown that better vitamin C level also means the less risk. Likewise, the European Investigation into Cancer and Nutrition, or EPIC, not for study in 2011, that's shown that every 20 micromole per liter increase in plasma vitamin C concentration reduce the risk of heart failure by 9%. So that's all from me about the example of nutrition approach to help solving the problems. Thank you.
Greetings, my name is Kadek Putri, which was student number 235. Now we've reached chapter 3 conclusion. Based on previous chapter, Water-soluble vitamins, including vitamin B complex and C, are easily absorbed in human body. These vitamins obtain from the diet, and it's important to balance the consume. But when it comes to RDA, the daily intake are based on individual's age, gender, and other condition. Deficiency one of these vitamins taken them into high risk, especially coronary artery disease. Now we've moved to recommendation. Adequate intake of vitamin B complex and C has their own functional. Vitamin B is involved in homocysteine metabolism, and vitamin C as an antioxidant, which is linked to CAD. For future research, could further examine the specific mechanism between characteristic of vitamin B complex and C in coronary artery disease. That's all from us. Small group discussion of B3. Thank you so much for listening.